All right, here's a little video. I am just working on the back of this patient's knee, and she's got a lot of tightness and she feels a little pain when she, what is it, sitting to standing? Feels tight and then it loosens up, but we're trying to loosen it up so that when she gets out of the chair, it doesn't feel so tight. Okay, down and back and go. And all I'm doing is I'm putting pressure on the muscles of the back of the knee. We're looking for hurts good pressure. Nothing should ever be too painful. Back. And I'm moving from lateral to medial with very kind of a moderate pressure. Hurts good.
Yeah.
We're always looking for that hurts good feeling. I never want to put so much pressure that she's moaning in too much discomfort. We always want to be right on that edge. And back. Go. I'm doing that. Lower leg, high part right here. Or lower leg. Go. Not sure what I wanted to say there. Proximal. Back. Go. Pressure's good.
Yeah.
Back. Go.
Yeah.
Back. Go. This is active release therapy I'm doing, otherwise known as myofascial therapy. I've kind of modified my active release therapy technique where I slide a little bit more. I get excellent results this way. I've been doing this for years. So we're just trying to... Vina, how old are you again?
78.
78, okay. So this is really excellent work for someone her age, because a lot of people in their 70s, the muscles just get tight because they're not as physically active as they used to be, and things can just get stiff, and this kind of work really loosens it up and just improves quality of life. She is definitely seeing some improvement. Okay. We're going to also work the back of the right knee the same way, and then I'm going to work on the front of her right knee as well.